Everyday injustice. Too many wrongful convictions. Corruption has infected the criminal justice system, leaving too many people helpless, fighting for their lives. Instead of receiving justice, people suffer. Is that why they say justice is blind?
Today on Everyday Injustice, we have Melonie Perez. She is the staff organizer behind the Walls Committee, and she works for Direct Action for Rights and Equality, which is DARE. Now, I'm old enough to know DARE is another name, but
definitely. A lot of people confuse us for drug abuse resistance education. I guess our difference is we don't have the periods in between the letters. That's what they say.
There we go.
Yeah.
So can you tell us a bit about your background and what DARE does?
So DARE is a nonprofit organization, and we organize low-income families for social, economic, and political justice. And my committee, the Behind the Walls Committee, we're formerly incarcerated people and the loved ones of formerly incarcerated people. And we just try to organize to try to have some like prison reform or even some justice reform, criminal justice reform.
And do you want to introduce your colleague behind you?
Hi, so Perez Robinson. I'm on the board at DARE as secretary. I'm also the campaign manager, organizer, and lobbyist for the Stop Torture I Coalition.
All right. Well, it's great having people from Rhode Island on because I'm not sure we've ever actually covered anything in Rhode Island. But it appears that unfortunately the problems in Rhode Island are happening across the country with in-custody deaths of incarcerated people. And I guess 4 incarcerated people have died in the last 3 months at the facility in Cranston, Rhode Island. So maybe you could talk a little bit about what happened and what you know at this point.
Yeah, so pretty quickly, there was like probably in the span of 2 weeks, 3 people had passed away. And it really caught our attention. We had already been organizing around the deaths because last year we had 7 deaths. And when you look it up, it should only be, it's 1.4 deaths per 1,000. So we only have about 2,000, a little over 2,000 incarcerated people. So it should only be 3 deaths a year. So we've definitely been keeping our eye on the death toll, and it's seeming very much so that it's just poor medical attention, poor medical treatment. They're not being taken seriously, and death resulting, and it's horrific.
One of the main things also is that that sticks up to us is that so they have 3 different responses to 3 different types of codes. They have a code red, which is for fires. They have a code blue, which is for physical altercations, and they have a code white for medical emergencies. And so for code blues and code reds, they run to these codes. But for a code white, a medical emergency, they walk to these medical emergencies. And several of the deaths, the individuals were asking for help for days and hours on end with minimal response. And the 3rd death, the individual had a heart attack on the basketball court, and the nurse walked down to him. She wasn't there in the area. She walked down to him. She found out what was happening. He's having a heart attack. Knowing he's having a heart attack, she walked back to the dispensary, which is like the in-jail hospital. And knowing he's having a heart attack, she walked back to him with the EKG machine. And by the time she got back to him, he was dead.
Wow.
And it took them 9 minutes to actually even start administering life-saving procedures on him, like CPR. Took 9 minutes. Those are crucial moments, especially at that time, you know? And if
So
they
do you
get
think
cleared,
this
it
is a
would-
lack of training? Do you think it's a lack of care? I mean, what is your sense at this point?
So the Department of Corrections here does say that every correctional officer knows CPR, CPR certified. So maybe it's not lack of training. I think more a lack of care. And lack of accountability too, because when these things happen, no one's being held accountable. Nothing's happening to the people that are responsible for it. You know.
I also think it's bad policy. So yes, we've met with the administration and we questioned the medical director, the assistant medical director, and she did say that all correctional officers are trained with first responder training, but they don't administer first responding training. What they do is when they notice a medical emergency, they call for a nurse, and the nurse once again walks to the response. And in that time frame that she's walking to the response, that correctional officer is not administering first responder response. Last year, an individual who had seizures was on a top bunk, even though he was medical bottom. He had a seizure in his sleep, fell off the top bunk, cracked his head open. His roommate called for assistance, banging on a door. The CO was sleeping. It took them like a good 20 minutes to wake them up. Then the nurse had to come. That correctional officer sat there and watched that man take his last breath without providing any kind of assistance. And we asked the one of the director's assistants, Ryan Crowley, like, why can't a nurse run to these codes? And they said, oh, they do not run. They do not run. And when a correctional officer passes away in the ACI, everything stops. There's no wreck. There's chow in the hole you eat in your cell. You get a brown paper bag. The building is closed down. COs leave the building because they said COs leave the building to go mourn that correctional officer. When an individual incarcerated passes away, rec is open, gym is open, school is open, business as usual. So it's bad policy.
Melonie, you had mentioned before we got on the air that on Wednesday, you and family members from of the deceased met with the attorney or the lieutenant governor or attorney general?
The lieutenant governor, yeah.
Yeah. So can you tell us a little bit about that conversation and what might come of this?
So she was a little unprepared, I guess. We should have sent her some questions ahead of time so she could have done some investigating, definitely. But she was responsive where she said that she would look into the deaths and she would look into some sort of oversight committee. I definitely told her. I had gone to a conference in Minneapolis, Minnesota, and I met a woman that was on an ombudsman committee, which is an oversight committee for their Department of Corrections. And I told her, I said, we need something like that. We need an oversight committee, like an independent panel that has formerly incarcerated people on it, someone from the DOC, someone from the Department of Health, even someone probably from the state police, to just be overseeing what is going on in there. She was very responsive. It was definitely an emotional night. Our usual meeting ended up going way over, like 45 minutes over our usual time. And she wasn't able to give us any answers. She didn't want to presumptively say anything. So it was definitely just informative. And we're going to continue to talk with her. She did seem worried and troubled by what was happening. So hopefully something good will come out of it.
From your perspective, what are your biggest concerns about what's happened in the last few weeks?
My biggest concern, so I have a son that is doing 24 years plus life. So he's been there for a long time. And I worry about him. I worry if something's wrong with him, if he's not being taken care of properly, if he's not, it's just, they get, subpar medical treatment, like way below what is considered standard of care. It is way below a standard of care. So I worry. I just worry a lot about it, and I need to, shed light on the fact that these people, regardless of what they do, they are human beings. They deserve humane treatment. So I worry. I don't know if Brandon, what do you think about?
Um, so similar to what she's saying, I served 15 years in there. I did 4 years in the intake service center, 8 months in the high security building, and 10 years in the medium security building. And when somebody, so her son is coming in young. I went in at 19. I got it at 34. You develop like kind of ailments and different kind of injuries and sicknesses that do not get tended to while you're there. And it takes for you to get released in order for it to get tended to. And the building is not set up for like senior citizens or older individuals. It's set up for younger individuals. So as an individual ages in there, they're not receiving the proper medical care, and they really get dismissed to the point that if you have a situation like Willie Washington Jr., who was 25 years old, and like I said, I came in at 19, and imagine if at 25 years old I experienced something like what he experienced, I would not be here today. So there's many individuals that should be making it out that may not make it out just because of the lack of medical care and treatment that's being provided in there. And I just actually got confirmation this morning because something that we're fighting for, which is free communications. They're now being allowed free phone calls on Fridays, 1 to 2 free phone calls on Fridays. And so individuals blowing up my phone this morning, and I got confirmation that a week or two ago, they shut the building down and raided the blocks because they thought an individual passed away, but they were able to revive him. So he overdosed. Mm-hmm. So individual, again, just basically died, but they brought him back. This seems like a continuous process that a lot of young individuals are not going to make it out of there. And so basically the pandemic or the crisis that we're having out here with the opioid crisis and different things like that is affecting individuals inside, and this is supposed to be a secure facility. So that for all the training that they're receiving, it seems like they're not using it, and this is very worrisome for us.
And all of these guys are young, right? I mean, we're talking guys in their 20s, right?
Yes, 20s, 30s at the latest.
Mm-hmm.
So, you mentioned Willie Washington and also William Page. Both of them complained of health issues to the facility's medical staff and apparently were given inadequate care. What are you guys hoping can change about the medical response here?
Policy, run to these people, definitely run. Come equipped with the AED machine or whatever needs to happen, or whatever they need to bring, to be able to assist them when they're in most need. Definitely. And
it was like basically Willie Washington Jr. and Deion Knowles, who was the second individual who passed away. Those two were the ones that really had an opportunity to complain and ask for help. William Page, actually, it was kind of, he dropped on the ground, he asked for help in a moment, and there was one situation where it just boom, 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 it happened. And one thing that we asked the medical assistant director was in regards to this policy of running, she said, oh, they can't run. So I asked her, so we want them to be held accountable. So if they're not following the proper protocol, the proper procedure, we want them held accountable, and we want transparency for that. We want transparency. We want to know if they did the right thing or didn't follow procedure, or did follow procedure, as well as for the correctional officer on scene.
And in terms of the correction system, do you feel like they've been responsive to your concerns, or that they're ignoring them?
They're not ignoring our concerns. They're walking around the subject, or giving us kind of like blanket statements, like I would like you to know that the health and well-being of our people in our custody is top priority. Like they just say things like that, where it's like it's just blanket statements.
So they're being bureaucrats, basically.
Yeah, a good portion of it is appeasement, but as you know, the political pressure kind of scares them, because as we work together as community organizations, they understand about people power, and the director's job is actually to stay out of the newspaper so that the governor doesn't feel the backlash of what's happening underneath his custody and care. And unfortunately, the correctional staff and union kind of not getting along with the administration, and so they're constantly putting them in the newspaper, and we're constantly putting them in the newspaper and holding their feet to the fire, so that the governor has to pay attention to this stuff, and we're asking and demanding for change.
Now, Brandon, what does your campaign look like at this point?
Are you referring to the solitary reform campaign?
Well, the campaign to investigate these deaths.
So right now we've banded together, as you may have known, banded together to spread awareness and hold these people accountable. And there's little changes happening little by little. I'm just speaking to the individuals inside, and we also receive letters from the individual side. We send surveys and things of that nature. And so there's little changes that are happening. And this is what they literally just told me this morning. Like, little by little, there's things that's happening. But at the same time, and unfortunately, the correctional staff, in Rhode Island, they feel like it's slighted that people are getting fair treatment. And that's all they're asking for, is fair treatment, like to be treated humanely, to be given an opportunity to be rehabilitated. And I think that we must keep an eye on them and let them know that we're watching. And we're also going to continue spreading awareness to the community.
We also, he has his solitary confinement reform bill that we added and amended to include medical oversight. So we can try to just keep an eye on it, just try to have some accountability from them.
Now, I understand that DARE, as part of 9 other advocacy organizations, recently signed an open letter calling for an independent investigation into the deaths. Can you tell us what this letter says and what you hope it will accomplish?
So the letter basically is a letter with the 9 organizations: Black Lives Matter, DARE, the Black Lives Matter PAC, the NAACP, ACLU, Open Doors, and Stop Torture RI. And we're basically banding together to let them know, like, once again, like I said, we're watching, we want change, we want an internal and external investigation. And like, these families deserve answers, and they don't deserve for this thing to be swept underneath the rug and to be put down as, oh, they had the flu, or they were using drugs. Oh no, they have an opportunity to stop this, and they're underneath their custody and care, and we're going to hold them accountable. And that was just a letter letting them know that, yes, we're going to hold you accountable. We're going to be outside. We're going to be protesting. We're going to be talking to the media. This thing is not going to get swept underneath the rug.
And do you feel like the system is open to these types of changes?
No, they definitely, no. So they responded to the letter. Recently, I think 2 days ago, they responded to the letter, and they're they're saying that they already have oversight. They already have internal investigations and external investigations, but the external investigation is done by the Rhode Island State Police, and even we've heard that they don't even acknowledge some of the complaints that happen that the prisoners, because the prisoners can call if they have a complaint against someone, or if there's an issue inside there, they can call the state police and file a report or a grievance, and or well, a problem, and that they don't even take that seriously. So I mean, they're under the same umbrella, though. You know, like the Rhode Island State Police and the correctional officers and the DOC. They're under that same. They're just trying to protect each other constantly, you know, and cover up for each other and make things not seem so horrible. But they're horrible. This many deaths should not be happening, and something's going on in there where it, they're not getting treated correctly. And I actually heard this morning that it's happening in Pennsylvania too. The death toll out in Pennsylvania is rising. So I mean, it's across the country that this is happening. Like, why? What is going on? Don't know.
Yeah, I mean that is a big problem. I'm out in California, and I know like the LA jail has had just a horrific run of in custody deaths in the last 6 months or so, and I think the number is like 15 or 20 in 2024 already. So I mean, it is an epidemic.
Yeah, definitely. These people were sentenced to years, not to death. So
Yeah, and I think that's a really important point because I think all too many people are like, well, they're in jail. They're bad people. They did something wrong. Um, and they kind of shrug this stuff off. I mean, but this has like a tremendous impact on the families, and unfortunately, we were hoping some of the families were going to be able to come on this show. But I mean, can you talk about the impact on the families of these people?
oh, they're so devastated. Willie Washington's mother is so devastated. It hurts me. It hurts my heart. Billy Page's family they're beside themselves. Like, there was nothing wrong with Billy Page. He was a healthy man. So for something to happen to him, it's confusing, and it doesn't make sense, and they want answers, and they're not getting any answers from the state police. They're not getting any answers from the DOC. They're going out for autopsies, but no reports are being given to the family. So it's secretive. Why is that so secret? That should be very transparent to the families. You know what's going on, how the investigation is going. What are they doing to investigate? Who are they questioning? What are their leads? You know, these are things that the families want to know and need to know for just peace of mind. You know?
Yeah, I think what we try to do also is let the people in the community understand that, especially in the communities where people may not be able to relate to these families, is that this could be anyone's child, right? If you have a child who is part of the LGBTQ community or who suffers from mental health illness, these are two things that could easily land somebody in the DOC and could end up suffering from these consequences. And we don't have the death penalty in Rhode Island. So everybody that goes in should be coming out unless they have life without parole. And so when a person's going in, they're paying when they're sentenced to their time, they're paying they're paying the punishment for the crime that they committed. And now is where they're like, basically receiving penance, where they're doing their time and they're seeking rehabilitation. and preparing to reintegrate back into society. And so for them not to be making it back out, nobody, they didn't sign up for that. And the families did not expect that. And so this seems like senseless deaths that's happening. And they have children.
So as we wrap up, what are your next steps, and what would you like the public to do?
Rally with us and come with us and definitely spread awareness. Have compassion for the people inside. A lot of them suffer from mental health disease or substance abuse issues, and you know they need help. They need rehabilitation. They need help. They don't need to die, and they definitely just it doesn't make sense for them to be dying. So I mean, definitely call out to the public to spread awareness and just be sympathetic. Definitely.
All right. Well, I want to thank you guys for joining me. This is a really tragic situation, and unfortunately one that seems to be happening across the country. Hopefully we can shed a little bit more light on what's going on and put a little bit more pressure on the facilities to clean up their act and make the conditions of confinement more safe.
Oh, definitely. And over here too, we have a big issue with just the conditions of the building. The maximum security building was built in the 1800s. Has no ventilation. There's mold. There's rodent problems. There's poor air quality, and even a friend of mine had just gone into the intake center and was speaking on how the vets have a trail of dust going like 5 feet away from the vents. You know why? And even in the kitchen areas, above the kitchen stoves, there's holes and falling pieces of the ceiling. You know, just the conditions of the building and what they're expected to live in is deplorable. It's just so horrible. So I mean, definitely, they need to, exactly what you said, they need to get their act together.
Yeah, and you know, I feel like a lot of people kind of again shrug this off because they're incarcerated people, but remember, these are somebody's sons, somebody's parents, you know, somebody's family members, and these people weren't sentenced to die. They were sentenced to serve some time. And you know, it is the responsibility of the government to make sure that their lives are valued and protected, even if they've made mistakes in their past.
Exactly.
This has been Everyday Injustice. We've been talking with Melonie, Perez, and Brandon from DARE. Thanks for joining us this week, and join us again next week for more tales from the injustice system.
Thank you to George Powell and Norman Mousequake Barrett for the use of our opening, Everyday Injustice. You can see more of George's music at www.justiceforgeorgepowell.com.